My name's Will Sulivan. I'm a physiotherapist. I work in Blackburn with Darwin. I spend my working day working with people with COPD. I'm going to talk a bit about the development of an app which we've taken from the old, I don't know, does anyone still use paper in the room? But I do. But so there's barriers and challenges to developing this new technology and then using it with the end users, our patients. We developed, along with my associate Glyn Bax, we developed a paper version of a COPD care plan for exacerbation management, and thankfully, as we progressed through the process, funding was achieved through a local CCG to develop to convert it from the paper and the CD version into an app, and we did that in partnership with a health company called Intellicent, which Jonathan will speak about later, from their sort of the challenges that they've faced getting it to market. Well, COPD. If we look at the three local CCGs, Blackburn with Darwin, East Lancashire, the four CCGs, Preston, Chorley and South Ribble, we have about 21,000 patients diagnosed with COPD, and I think for the northwest as a whole it's something like 102,000, and roughly the prevalence is about 2.5 compared to England at 1.8. I'm thinking these figures off the top of my head, but I did check them this morning on the QOF database, so they may be slightly out, but the evidence is that we do have a big population within the northwest. And unfortunately with that comes big hospital admissions, and that's something that's very close to my heart at the moment, working very hard in Blackburn with Darwin to try and reduce the hospital admissions. But I'm going to focus on the work that was done in central Preston and Chorley and South Ribble CCGs. They were tasked with probably 2 years ago about reducing hospital admissions to try and obviously reduce the dependence on secondary care. And fundamental, that's sometimes forgotten, is about behaviour change and reducing the reliance of patients to need secondary care, to give them an alternative to freeing or to services to use. And fundamental to there is self-management. And I think it's something that quite often is forgotten in the process. So that was really the emphasis for us producing the paper version. And thankfully, the funding was sourced to convert our paper COPD management plans into an app, which we've called, well, the strategy is called How Are You Today? It's a question we probably, as professional clinicians, we're asking our patients most days, how are you doing today, how are things? And we're asking the question for them to actually self-assess their presence and to see whether do I need to take an action. Going from the paper version to the app for me was very exciting as a clinician, and I didn't actually realise the barriers, as the other speakers have talked about, the information governance, who updates it, who registers it. So it was a big challenge, and I'm sure Jonathan will be able to talk a bit more about that in a few minutes. But it is there, it's on the App Store, you can download it. At the moment, I think there's plans to have a How Are You Today Lite, but at the moment it's registered with the respiratory nurse. They register you on the app. They set up your action plan, your care plan, your rescue pack, your antibiotics, your steroids, your trigger points, and then they run through it with you. They're able to monitor your daily, so the patient logs on, takes scores, their status, how breathless, how much they're coughing up, how they feel, and that health care professional who's registered can actually view that, and that way you get that interaction, and that, I think at the moment they can ping you to say this person's having a red day, a good day, we should do something about it. These are this gentleman here, Paul, is a super user. He lives in Blackburn. You can also register important people. So he has his daughter who lives in, I was going to say Arbroath, but it's not, it's Dundee, and she can find out how her dad's doing around using that daily input, and that's actually, he's been using that he has also has other conditions as well, but he reckons it's probably initiated his action to take his rescue pack and go into his GP and actually to do something about it. He's finding it really useful, and it's working for him. He's quite let's say he's interested in tech. As part of the process to build up to that, once the sort of draft of the app was ready to use, we have trialled it with members of our local patient support group with COPD. And these people ranged from 50-year-olds right up to people one lady into her 80s. And 50% of that population had the equipment to use the app. I know one of the barriers maybe you may be thinking about, we're looking maybe with an older population, have they the information and ability to use these sorts of equipment? So we knew that we had 50% of those people in the room of about the 25 residents that came that had the equipment to use it. So it is something that we've got to consider, but it is the future. I don't think it's not going to go away. Now I'm going to put up a rather, I don't know whether Jonathan may be able to talk me through this one, but this is the schematic, the sort of diagrammatic problems about taking the thought to something to the person using it. The information governance, who updates it, making sure that the flow is right, so when the patient answers one question, does it trigger another one? It's all based on nice guidance. Now, I can't make, this is the technical side of it, but this is the complexity behind getting it from the thought, the innovation, to the actual product. And it's actually being used with our patients at the moment. A lot of thought was put into actually how they use it, colourful, making it easy. We've got the important person, your healthcare professional, whoever's linked into that app, and that's under the patient's choice. They own it. They can link you into their conversations, their status, so you know how they're doing. So you can ping either voice messages or word messages backwards and forwards. There's a record of it, so you've got a trend line of how they're doing. It does everything that it's meant to do, and it's working very well. Jonathan, would you like to add?
Good morning, and thank you very much for inviting us to talk about How Are You Today. I don't really want to talk about the app. I think the emphasis today is about innovation. I just wanted to share with you some sort of experiences I had going through this process. So I came into this whole sector, I think, very naively 2 or 3 years ago when I left my previous job. I've been for 12 years involved in big data in the automotive industry, and all my work was around connecting cars, and it seemed to me that the world of automotive was far more advanced in many respects than healthcare. We were able to connect cars and know how they were doing and know where they were going, but we couldn't do the same thing with people. So somewhat naively, I launched into this idea, this whole area of connected health. And we developed some things. We got some great help from Dennis, who I see over there, and we got a platform set up. And we took it around, and through various twists and turns, we met with Will and colleagues at Lancashire Care Foundation Trust. They said, basically, can you take what you've done and apply it to this problem of COPD, which is what we've done. Just want to share my perspectives looking at the whole thing in terms of what I've learned from it. The first thing is that, as many people will know, the big challenge you have when you're trying to innovate with a new product in the NHS is the whole issue around evidence. People don't want to buy something from you unless you've got evidence that it works. But in order to get the evidence, you need people to work with you. And actually, that is, for me, is the fundamental challenge, how you overcome that. And how you keep things going in the face of that. And I think we're really fortunate, and I would encourage anybody else in that situation, just to find an organisation inside the NHS that is willing to take a little bit of a risk, that's got got the room and the self-confidence that believes in what you're doing to take a little bit of a risk with you, and that's really important. That's what helped us. The second bit then is, having got that, is really what you need to do once you develop the app, is really to get numbers through it. You need to get people using it. And I think there's kind of 3 stages there, and we're not over it. We're right in the thick of this. But to get the numbers on, first of all, you've got to convince the clinicians that are talking to the patients. So Will and Lynn have done a fantastic job in enthusiasm around them. But what they've got to do, they don't see all the patients. They've got to convince the people that see the patients that this isn't just a waste of time. And there's a lot of work to be done then. And then when you've got those clinicians on board, they need to persuade the patients that it's worth doing. And then when you've got the patients finally signed up, you need to persuade them to keep going with it, because what you learn very, very quickly, and I know this from my own behaviour, is what we need as kind of understanding the condition is we want people to record how they are on days when they feel great and on days when they feel terrible. But what ends up happening, as probably most of us know, is that people are quite good at recording the bad days, but they don't always record the good days. So actually, what we're really focused on is actually working on each of those things, from the clinician to get the patients to sign up and onto the adherence. And it's early days, and we're learning very, very fast. But it takes a lot of energy and a lot of determination, and we're still in the middle of it. So I'll try to be as honest as I can be. Thank you very much.